So the condyle then models back, which is shown in the picture number 3. Now, if the patient then closes the mouth, that forces the condyle back against the attachment. I hope you understand. What I'm saying is that normally the condyle will always grow to the center of the joint. That is natural for every person. If your mouth is open, then the condyle will grow to the center of the joint with your mouth open. So if you then close your mouth, the condyle will be forced back against the posterior attachment. Do you all understand? Does anybody not understand that?
Yes.
I understand.
Because that is the reason patients have pain. If you leave your mouth open, the condylar head moves forward. If you hold it there for a long time, the condylar head will remodel back into the center of the joint. So somebody who constantly leaves their mouth open, the condylar head will constantly remodel back. It's important that you all understand that, because then, if the patient shuts their mouth, the condylar head will bang against the back of the joint, where the attachment is to the disc. This will damage the attachment, so the disc will become displaced. I don't know if I can explain that any better. The presentation, I don't know what time we have. The presentation in full takes over an hour. I'm just showing parts of it, but could you show me the picture? There are 2 patients I showed there. We'll go through 4 picture demonstrations. Yes, that one. You go back one, it doesn't matter. I press it. Yes, this lady came to me. She was age 18. She had persistent TMG pain, which recurred when she left her splint out. She'd been treated with a Gelb splint. I'm sure many of you are familiar with that. The idea of a splint is to rest the joint. And yes, it works. If you fit a splint, usually you will get about 4, maybe 6 weeks, perhaps a few months of less pain. But gradually, the condyle will remodel to the center of the joint again, and when you take the splint out, you will have worse pain. So a splint is good to rest a joint, but it is not good to cure a joint. It will be okay for a while. So the important thing is to bring the mandible forward. And in this case, for this girl, can you see her mandible is back? You can see the underneath of her chin is down. Anyway, you can see she has come forward there. Her mandible, I think, about 12 millimeters. And also you can see the change in her maxilla, which has come forward as well. You have to look quite closely to see it, but the mandible has come forward, I would say, about 10, 12 millimeters. And as a result, her pain stopped. But let me see the next slide. This is a girl who had pain, age 28. She had been to many specialists and she had constant pain. But she did get an improvement with the guilt, but the pain recurred when it was removed. She had been treated so that she was wearing a splint continuously with slight pain. and she was sent to me to correct her teeth as the joint had been cured. But in fact, the joint had not been cured. So I treated her with a stage 3, and that was the change in her face. Now, remember, she is